When the World Health Organization approved the world's first malaria vaccine in 2021, officials called it groundbreaking. That vaccine is known as RTSS, and it is being used right now in Ghana, Kenya, and Malawi as part of a pilot program. Now, RTSS is expanding to 9 more countries within Africa, with 18 million doses on the way over the next 2 years. Joining us now to talk about why this is so important is infectious diseases specialist, Dr. Isaac Bogoch. I think somebody's knocking on your door. We can get to that in a minute.
It's
I'm assuming.
my wife.
Good morning to her, and good morning to you. It's been a minute since we've seen you. So let's talk about this. Malaria, as we know, is one of the leading causes of death in Africa. The WHO says there were 247 million cases. Do you want to answer it? I can get back to it.
No, it's okay. Let's keep going.
Okay, so 247 million cases of malaria around the world. That was in 2021. 619,000 people died. 96% of the people who died were in Africa. So let's talk about this vaccine, doctor. What impact will it have?
No, this is a very important vaccine. And as you point out, there's about 600,000 malaria-related deaths per year on the planet. 80% of those are in Africa. 80% of those are in kids under the age of 5, and about 96% of those are in Africa. This is an extremely important vaccine that is going to have a tremendous impact. The issue is, as you mentioned, there's 18 million doses of this vaccine. It's a 4-dose vaccine. So that's really only enough vaccine for about 4.5 million kids. That's a start, but that's nowhere near what's needed. I think the other important point, too, is that the vaccine's effectiveness is about 30% throughout a 4-year period of time. That's still really good. That's still a lot better than nothing. And we know malaria is so devastating, but there are other vaccines in the pipeline that may have higher efficacy against severe illness and may be rolled out in subsequent years.
And we'll be getting to that in just a moment. But in terms of, you talk about supply and if there's enough right now, what is the plan for distribution?
So currently, it's just known that this vaccine will be distributed among those 12 countries, and those 12 countries are really countries that are more severely impacted by malaria. Of course, we know they're all in Africa because Africa is more heavily impacted compared to other parts of the world. And I think as we start to see supply increase with this vaccine, we'll see more and more countries in Africa have access to this vaccine, and then we'll see the countries that have access to the vaccine get more access to the vaccine so they can expand it to other at-risk children.
You know, we as a population now are so much more well-versed in vaccines, their effectiveness, how long it takes them to come to market. So when you look at the malaria vaccine, it's been in the works for, what, decades? Why has it taken so long?
Well, unfortunately, it doesn't get the same attention as other areas of medicine. And sadly, the diseases that typically impact low-income and low-middle-income countries just don't receive the same degree of funding versus other diseases that impact high-income countries more significantly, like cancer or heart disease, for example. But, there has been a significant shift, and diseases like malaria, tuberculosis, and other what we would call neglected tropical diseases are getting more attention, more funding, and there's been some tremendous progress in really preventing and treating these diseases. And we know that many of these diseases impact billions and billions of people on the planet. So it's well past time that they get the funding and the attention that they deserve.
So you mentioned this off the top. Future malaria vaccines could be on the way shortly. The University of Oxford's R21 vaccine was approved for use in children ages 3 to 5 in April. COVID vaccine manufacturer BioNTech announced its plan to make an mRNA malaria vaccine in 2021. Can malaria vaccination pivot from a pilot project to a routine immunization campaign?
It absolutely can, and it probably will, and we'll likely see the studies emerge, the phase 1, phase 2, phase 3 clinical studies emerge with these other malaria vaccines, and once they do, we'll likely start to see larger scale implementation of these vaccines and use of these vaccines in real world settings and really protect a very, very broad cohort of individuals, especially at-risk children in African settings.
Dr. Isaac Bogoch, good to see you as always. Thank you.
Good to see you as well, Lindsey.
Say hi to your wife for us. All right.
Will do.
I wonder what she wants.
Hey, thanks for watching. If you liked this, be sure to subscribe here, or you can check out more Your Morning videos right here.